Come in. Come in. Have a seat. Yeah. I know you just made the appointment today. Yeah, we squeezed you in because it sounded like you really wanted to get, you've been having a little bit of issues. Alright, you banged your head. Fell off the ladder outside. Yeah. When was that? That was Saturday. Right, today's Monday. Alright, well, honestly, I'm going to honestly say that after this, you should probably you should probably get to, just go to an ER, one of those walk-in clinics, and, just get your head scanned. You could have concussion symptoms here, but I will assist with how I can, at least to see if your eyes aren't, are really not acting the way they should be. Definitely, get there and get this done as soon as possible, because it's not good to even really wait too long on this. But obviously we got you in here because it sounded urgent, and it seems to be, so let's just take a look. Let me just call up your file. Alright, I just want to do these results against those just to see how they're playing off, because your eyesight is pretty good. So I want to see how that plays off. Alright. Okay, so let me see. Alright, first things first. I want to just check your eyes. My light here. See how they act to the light. Alright, yeah, just cover your one eye. Do it a little brighter. I'm going to move it off and then back in. Alright, that eye seems alright in terms of it's constricting properly and everything expanding properly, so let's do the other one. Alright, cover your other eye. Alright, let me come in from the side. Yeah, alright, there is a little bit of a delay in this eye with the expanding of it to the light, so it kind of reacts slow. That is a little bit of a concussion symptom. So yes, definitely get your head scanned. I'm not going to tell you it's life-threatening or anything, because it isn't, but if you're having these experiences, you want to get it checked out just to see if there is anything going on inside the head there that could become a much, much bigger problem if you let it sit. Right. I got another light here. I just want to blink at your eyes real quickly. You can keep them both open. I just want to click at them both just to see. And just blink. When I click on the light, just blink. Alright? Alright, here we go. Yep, just blink when the light goes. Alright, open your eyes now. Actually, I'm sorry, keep them closed and then open them when I tell you to. Alright, open. Alright, close them again. Open. Alright, yeah. This eye is definitely not, like I said, it's not reacting. It's a little bit of a delayed reaction from this eye. Like, it's not kind of like getting what's hitting there. And then, like I said, your eyesight is usually good. And this one's reacting slower, so there might be a little bit of a problem on this side of the head. Did you fall on this side of your head? You did. Alright, well, that could explain that. Okay. Alright, well, just want you to, the usual tests here. I want to kind of like get you out of here as quickly as possible. Like I said, I really want you to get this done. Like, I'd prefer you go to the ER. There's no issues with that, right? All right, yeah, good. Just because they have, these urgent care clinics do have a lot at their disposal, but if they want to maybe keep you overnight or something just to keep an eye on you, that's something that will probably be helpful. So probably better to go there, because they might just, you go to the urgent care clinic, they might just send you to the ER anyway. All right, well, look at me, directly at me. Don't move your head at all, just right here. All right, just follow the pen with your eyes. Do not move your head while following it. All right, okay. All right, now close your one eye. Yeah. Same thing. All right, now tell me when it goes out of your line of sight. All right, perfect. All right, same thing, close this eye. All right, now tell me when it goes out of your line of sight. Right there. All right. Yes, that isn't great. It looks like you've lost a little bit peripheral vision on this side, which is also, a concussion type thing. Kind of rattles your head. Your eyesight will get a little weaker. But like I said, you need to get it looked at so it doesn't become any kind of permanent issue. Okay, you see the chart here. You know how it goes. Yeah, we're going to do, just want you to read down the chart. I want to see how it is. I'll compare how your eyes do with it. And I want to compare it to this one just to see how much worse your eyesight's possibly gotten in this one, because we know how good they both are from the records. And this wouldn't be like a natural old age thing or some kind of like infection or anything. This obviously would be specifically from your fall. So I want to see. All right. Well, we're going to do both eyes first. All right. You ready? Yep. Line 2. Yep. 3. 4. 5. Yep. 6. 7. 8. Right. 9. A little bit of trouble with 9 there. You missed 2. All right, let's try 10. Yeah, all right, so you missed a few on 10 as well. And you would always get through 10 pretty well. Let's just do 11 real quick. Can you... All right, you missed some there as well, but usually we're perfect through about 10, so were you like, yeah, I kind of noticed it. Exactly, yeah, you were straining it. You were using the good eye more. The eye that's not affecting you, you were using more to do that. All right. All right, close the bad eye, or the injured eye, I should say. Let's just see how the better eye is working, just to make sure there's no, from the other two things, this eye has seemed fine, but let's see. Yep. Yep. Mm-hmm. Yep. All right. Yep. All right. All right. Let's see. Good, you got them all there. 10. Now you missed 1 there, but that's an improvement. 11. All right, that's 2 there. All right, you see with the injured eye closed, you didn't have to strain with this eye, so you could just focus this eye, and you did well. Now this is going to be telling for me. Let me just call up. Yeah, you see that eye was fine. That's on par what it was. Now I want to see how the injured eye does. See how off it is from your last exam. Okay? All right, so close your eye. Here we go. Yep. Perfect. Yep. Let me see, you missed 1 here on 6. All right, 7. No, it's blurred. All right. You got 3 of them though. 8. No. Okay. All right. Yeah, you see, you were able to get through. Last time you only missed 1 on 9, and then 10 was a little bit of trouble. But now you're having trouble on 7, and 8 was a real problem. 9, yeah, all right, just real quickly close that one eye. All right, just can you see 9? No. All right. Also, have you had any headaches just after, other than, initially falling? It's going to obviously cause some head action. Got a little bit of one now and the day after as well. All right. Okay. Well, like I've said a few times, you absolutely should. You need to go get this checked out. Go to the ER. Just get them a head scan. See if they want to evaluate you for maybe 6 hours or 12 hours. I know it's not, ER is not fun, but yeah, your understanding of of the issue here. Okay. All right. Well, I have a test that I run for people who've had, either you've had, you're coming off a concussion, or you've, any kind of changes. I like to do this test. I use these cards for a little game I have at home. But I want to see how your eyes react to it. I want to see if you struggle or you just strain or it causes any dizziness or anything. All right. Okay, so first I just want you to have both eyes open. Take a look at this. How did that pattern make your head feel? Very slightly dizzy. That's with both eyes open. Okay. All right, how about this one? Yeah, I could see it there too. Yeah, it didn't look like you were liking looking at that. This one could be a little tough. Yeah, use that garbage can over there just in case you get sick. All right, here. I want you to look at this one as long as you can. All right. Yeah, well, at least you didn't throw up. But yes, they're making you a little bit dizzy. This one, the most. All right. Well, I want you to do both with both eyes now, just to really see if it's this eye that's causing it, and if your good eye is also affected. All right, close the bad eye. All right, let's do this one. All right, how'd that make you feel? Fine. Good. It even tells you on the thing, is a spiral effect making you dizzy? That will make you feel fine. All right, here's a tough one. Shimmering lines can be hypnotic, but we're not trying to hypnotize you. Yeah, as long as you can. It's not causing any problems? All right, good. This eye does seem fine, and you said you landed on this side of the head, so just issues on there, but you want to make sure for any bleeding in there or anything. even the slightest thing, although if that was the case, he might not be here right now. All right, close the good eye. Let's do them again. The bad eye. Does that make it dizzy? All right. I'm going to skip the middle one, and because it's going to be the same thing, but I want to see how much this one affects you, because this one is very can cause problems. All right, yeah, okay, sorry. Yeah, that made you nauseous and dizzy as well. And you don't have, like, things like that won't typically do that for you. They won't make you feel that way. All right, okay. And you don't wear glasses, so, all right, let me just, I'm gonna, even though you're going to the ER, I want to just I'll print you up, I'm not printing up, I'll send this over to, what's your primary, give me your primary care doctor's name first. All right, yeah, I know who he is. All right, so I'm gonna have them print this up for you. I'm gonna give you a referral here, just to bring it to the ER, just so they know you're there. So it's not like a typical ER visit if they want to hammer you with, you came for an emergency. I mean, it is, but this is something you want to just get looked at now instead of waiting. So, who's your neurologist as well? Oh yeah, she's really good. Yeah, one of the best we have around these parts. All right. Well, I sent this now to them, both of them, your primary care and your neurologist. And definitely see her, the neurologist, after you go get this test done. You go to the ER and everything, because they're going to want to follow up. They might put you on some medications and stuff, just if there's anything going on here. Maybe slight, very, very slight, maybe like a brain bruise or something like that. It could be, like I said, I know the eyes, but I'm no brain expert. So, but I do know from certain things that, the eyes will affect, eyesight is a big issue when you get a concussion and stuff. And it seems like you do have one. Has your speech been slurred or anything like that? No. Any trouble sleeping? Woken up a few times? That's not typical. All right. And you said you have a little headache now, and you had one. No vomiting? Well, that's good. All right. Well, this could just be a bang here. You got a bruise here. Maybe something got rattled in here. It could be a problem with your eye, which, hopefully it isn't. Hopefully it's something that just will go away. Maybe even after some rest, but you need to get that head scanned. All right. Yeah. All right. So just go up front. I'll have that printed out for you. You can come back to see me as well after you go to the neurologist, or you can just call and just, just clue me in on everything, let me know how everything went. Unless you want to come in and just see how the eyes improved, but they could probably do that, your neurologist as well. All right, well, good luck with that, and definitely, like I said, just go right over there, I'm not trying to alarm you or anything. It's just something, like if you let it linger and there's something there where, maybe they want to give you some medicine, or they just tell you some bed rest, or just to get a scan to see what happened in there, you need to be safe, All right. Well, I can't say it was good to see you, because it's not under the circumstances you typically will see, but get that checked out, go through all the avenues you need to do, and then call me, let me know how everything went. All right? All right, be safe.